Hello and welcome to today's session. In our previous session we looked at how we approach our casualty and how we carry out an initial assessment following Dr. ABC. Today we're going to take that a step further and consider this casualty that is lying in front of me, and we're going to consider the position they're in and how we manage that airway. At the moment their head is inclined to the side, that risk blocking the airway, as well as the potential for fluid building up at the back of the throat, making it difficult for them to breathe, which is a risk to their life. So we want to think about a position we put them in that is going to maintain that airway, allow for drainage, and allow us to safely go and call for an ambulance without a concern of that airway getting blocked. So let's take a look at the airway and what is happening when someone is lying on their back. If you look at this red head model here and think of it as a slicer of the head, you can see the nasal passage, you can see the mouth, you can see the passage down to the lungs and the passage down to the stomach. Here you have the jawline, and the white area represents the tongue. People often comment, oh, you can swallow your tongue. Well, technically you can't, because your tongue is attached to the jaw. But the tongue is a muscle. And like every other muscle in the body, when we go unresponsive, they all go relaxed. So the tongue relaxes, drops to the back of the throat and closes the airway. Now this is a great risk to our casualties. So we come along and we place the palm of the hand on the forehead and we tip back. But you'll see the mouth has opened, but the chin and the tongue have not moved, and so the airway is still closed. So we come along with 2 fingers underneath the chin. We lift the chin as we tip back. This pulls the tongue off the back of the throat, opens the airway and allows our casualty to breathe. Now if we let go, the head can relax, the jaw will drop and the tongue goes back to closing an airway. So when we're checking for breathing, we need to maintain this position. 2 fingers underneath the chin, lifting it up, the head tipped back. We can now check for breathing and identify whether our casualty is breathing or not. If they're breathing, we always talk about putting a casualty on their side, commonly known as the recovery position. So by turning them on their side, we're still making sure the head is back, the chin is lifted, and that the head is low. This will allow any fluid building up at the back of the throat to drain away and keep that airway clear. So the key things you need to remember when you've got a casualty that is lying on their back and you want to check for breathing: 2 fingers underneath the chin, palm of the hand on the forehead, tip back, lift the chin, pull the tongue off the back of the throat, keep that airway open while you check for breathing. Okay, so we've taken a look at the airway. So now how do we put it into practice in managing an airway in a safe position so we can go off and call the emergency services? So my casualty is currently lying here in front of me, and as we talked about previously, I would be coming in and doing my initial assessment. So I'm checking for my danger before I go down and making sure I'm not going to injure myself when I kneel down here. And then we want to think about response. So I'm coming in, hello, can you hear me? Can you open your eyes? Can you clasp my hand? So I've gone down close just in case there's any issue with hearing, and calling to them. I've been shaking the shoulders on an adult to see if I get a response, and I've been asking them to clasp my hand. So I'm checking the level of response based on what they might respond to. So I have a casualty that's not responding. So if I'm on my own, I'm going to shout for help. Somebody might then come who can do the call for the ambulance for me, so I do not have to leave my casualty on their own and I can manage their treatment. So having checked response, we want to check the airway. So I'm coming in, palm of the hand on the forehead, bringing it into alignment, 2 fingers underneath the chin and lifting, and then we're checking for breathing. Now during the time of COVID, to minimise the risk to ourselves, we're not going down close to check. We're watching the chest rise and fall and seeing that they are breathing, and we're watching for up to 10 seconds. So I can see that my casualty is breathing, so now I want to look at a safe position to manage that airway. So the hand nearest to us is going up into the stop position, which we're looking for a stop, but don't force it. let it naturally go where it's comfortable for the patient. Don't say Dave said, just let it naturally fall where it's comfortable. I'm just going to adjust this leg so it's in a natural position, allowing it for ease of turning the patient. I'm bringing the hand furthest away, back of the hand. There's a ring here, so I'm just turning to ensure that there's nothing going to dig in the side of the face. Holding that onto the side of the face, I'm not letting go, otherwise it would drop away. So I'm maintaining that position. The leg furthest away, I'm coming in, grabbing, supporting, foot's flat on the floor, and then I'm sitting up high. I sit back and I turn the casualty towards me and then use the leg, bringing it into 90. But again, what's safe for the casualty, if that will only go to there, that's the position we stop. The casualty is leaning towards me so they won't roll back. I then adjust the head, make sure I've got it pointing towards the floor so we've got the drainage and the head is back. Can then make sure that any clothing that will keep them warm is covering them, and make sure that I still have breathing now I've turned them over. They are now in a safe position on their side, will allow for drainage, keep the airway open. I can go off and call for the emergency services if no one's come to support me. I can let them know that the casualty is unresponsive, but they are breathing. So now let's see and put that into practice. As we approach the casualty, we check for danger, ensuring there's no risk to ourselves as we kneel down. We check for response by shaking the shoulder, we're talking close to them in case they're hard of hearing, and we ask them to clasp our hand. We shout for help to try and get attention towards us and get someone to call us an ambulance. We open the airway by placing the palm of the hand on the forehead, 2 fingers underneath the chin, tilting back and watching for breathing for up to 10 seconds. They are breathing, so we're going to put them in recovery position. The hand closest to us has gone up into the stop position. We've aligned their body to make it easier for us to turn. The hand furthest away has gone over with the back of the hand on the side of the face, and we've kept it there as we turn them over. We've used the knee furthest away from us to pull them over, and then we've adjusted to ensure they do not roll back. Finally, we open the airway, making sure that it is open, and then adjust the clothing to ensure they stay warm. We ensure that they are still breathing as we then leave to get emergency services. On return, we go back, again checking for the danger, kneeling down, looking to check the airway still open, and then placing our back of our hand near the face to feel for air and watch the chest rising and falling. So if you're currently working from home and having the challenge of entertaining your children while working, why not get a teddy bear and work with them to demonstrate the kids' skills on the teddy and then let them go off and play. Hopefully then the only interruption you'll get is, "Mummy, Daddy, look what I can do." Let's see this in practice. As we approach our casualty, we're checking for danger, ensure it's safe for us to kneel down. We're checking response by shaking the shoulders, talking to them and ask them to clasp our hand. If we're on our own, we shout for help, then we open the airway, palm of the hand on the forehead, 2 fingers underneath the chin, tipping back and watching for breathing for up to 10 seconds. The hand nearest to us goes in the stop position, hand furthest away comes over onto the side of the face, and we use the leg to turn them onto their side. With them on their side, we can now go and call for emergency services if nobody came to help us. On returning, we check that they're still safely on their side, that the head is back with an airway open, and that they are still breathing. This is how we put someone into recovery position. So in today's session, we've had a look at the casualty that we have found lying on their back, not responsive, but they are breathing. We've gone and put them into recovery position to maintain that airway, allow for drainage, ensure they stay breathing. The key thing you need to take away from today is if you can't remember all the steps of a recovery position, is that the person is on their side, the head is back and low so that you get the drainage, and that will maintain an airway. So in the next session we'll be taking a look at the secondary survey.